Hello, and welcome to the American Ambulance Bloodborne Pathogen Training Lecture. In this training, we will discuss what a bloodborne pathogen is, identify those who are at risk of bloodborne exposures, discuss key aspects of a bloodborne pathogen exposure control plan, and methods to control exposures and steps to take when you are exposed to a bloodborne pathogen. Over the years, there have been outbreaks of diseases around the world. 3 examples of outbreaks that have affected the U.S. include the 1981 outbreak of HIV, the 2014 outbreak of Ebola, and, most recently, the 2016 outbreak of the Zika virus. All 3 are examples of diseases that can spread through contact with infected blood or other bodily fluids. The CDC estimates that 5.6 million workers in the healthcare industry and related occupations are at risk of occupational exposure to bloodborne pathogens, including human immunodeficiency virus, HIV, hepatitis B virus, HBV, and hepatitis C virus, HCV, and other infectious fluids. All occupational exposure to blood or other potentially infectious materials places workers at risk for infection from bloodborne pathogens. Bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to hepatitis B, hepatitis C, and human immunodeficiency virus, HIV. Needle sticks and other sharp-related injuries are one of the more common ways workers can be exposed to bloodborne pathogens. Workers in many occupations, including first responders and other healthcare professionals, may be at risk for exposure to bloodborne pathogens. So let's begin by talking a little bit about hepatitis B virus, HBV. Hepatitis B poses a significant threat, causing severe liver disease that can lead to chronic conditions, permanent liver scarring, liver failure, or liver cancer, resulting in an estimated 2,000 to 4,000 deaths annually in the U.S. Symptoms include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, joint pain, and jaundice. HBV is highly transmissible, with a risk of infection ranging from 6% to 30% from a single needle stick. Alarmingly, half of those infected are unaware of their HBV status. Additionally, HBV can persist in dried blood on surfaces or contaminated needles for up to a week. Conversely, the risk of healthcare workers contracting HIV on the job is low, particularly if proper protective measures and equipment are utilized. The primary risk stems from accidental needle pricks, with the likelihood of HIV transmission estimated to be less than 1%. Hepatitis C virus, HCV, is another serious health concern due to a bloodborne exposure. Hepatitis C also targets the liver, causing inflammation and potentially leading to long-term health complications, including death. Chronic infection ensues in 75% to 85% of patients, with 70% progressing to active liver disease. Symptoms of HCV include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, joint pain, and jaundice. Alarmingly, approximately 3.2 million individuals in the U.S. are infected, with most remaining asymptomatic and unaware of their infection until decades later, when liver damage becomes evident in routine tests. Human immunodeficiency virus, HIV, is another formidable health challenge, leading to acquired immunodeficiency syndrome, AIDS, which attacks the body's immune system, progressively weakening it and making it susceptible to severe conditions like pneumonia or cancer. Nearly 7,000 individuals succumbed to HIV/AIDS in the U.S. in 2013. With more than 1.1 million people estimated to be living with HIV, close to 1 in 5 are unaware of their infection, as once contracted, the virus remains in the body for life. Symptoms of HIV infection vary, with some experiencing flu-like symptoms such as fever, chills, rash, and fatigue, while others may remain asymptomatic. Notably, HIV cannot survive outside a human host and does not persist long in the environment. Other blood-borne diseases can be caused by viruses or bacteria. They can circulate in blood for a prolonged period of time. This makes these viruses capable of being transmitted through blood or other potentially infectious materials. This is a list of other bloodborne diseases caused by viruses or bacteria. Though most are rare in the US, they are still transmitted through blood and other infectious materials. According to OSHA Standard 29 CFR 1910.1030, B, blood is the primary contamination source for exposures. However, other potentially infectious materials present significant risks in the workplace as well. This includes human blood, its components, and products derived from it, as well as various bodily fluids like semen, vaginal secretions, and cerebrospinal fluid. Additionally, other potentially infectious materials encompasses any unfixed tissue or organ from a human, excluding intact skin. It also includes HIV-containing cell or tissue cultures, as well as blood, organs, or tissues from experimental animals infected with HIV or HBV. These materials pose serious health hazards and require stringent safety measures to prevent exposure and transmission of infectious diseases. The spread of bloodborne pathogens primarily occurs through several routes. Direct contact involves the transfer of infected blood or bodily fluids, like mucus, from one person to another. Indirect contact happens when a person touches an object contaminated with the blood or bodily fluid of an infected individual. Respiratory transmission occurs when someone inhales respiratory droplets expelled by an infected person through coughing or sneezing. Vector-borne transmission involves a person's skin being penetrated by an organism carrying the disease, such as mosquitoes or ticks. Examples of modes of transmission include contact with another person's blood or bodily fluid, accidental injury by contaminated sharps or needles, contact with open cuts or abrasions, contact with mucous membranes in the eyes, mouth, nose, and ears, industrial accidents, administering first aid, post-accident cleanup, and janitorial or maintenance work. These various modes highlight the importance of stringent safety measures to prevent the spread of infectious diseases in various occupational and everyday scenarios. In most work situations, transmission is most likely to occur because of accidental puncture from contaminated needles, broken glass, or other sharps, contact between broken or damaged skin and infected body fluids, or contact between mucous membranes and infected body fluids. For example, if someone infected with HBV cut their finger on a piece of glass, and then you cut yourself on the now infected piece of glass, it is possible that you could contract the disease. Anytime there is blood-to-blood contact with infected blood or body fluids, there is a slight potential for transmission. Unbroken skin forms an impervious barrier against bloodborne pathogens. However, infected blood can enter your system through open sores, cuts, abrasions, acne, any sort of damaged or broken skin such as sunburn or blisters. Bloodborne pathogens may also be transmitted through the mucous membranes of the eyes, nose, and mouth. For example, a splash of contaminated blood to your eye, nose, or mouth could result in transmission of the pathogen. As EMS providers, we are in an occupation who are at risk for exposures to bloodborne pathogens. According to the CDC, there are 7,000 to 10,000 healthcare workers in the U.S. who have been exposed to infectious blood and bodily fluids, which led to a viral infection or deaths. According to the Department of Labor Statistics, it is estimated that these exposures to bloodborne pathogens has led to more than 200 deaths of healthcare providers annually. So, who is at risk of injury? Data from the National Surveillance System for Healthcare Workers show that nurses sustain the highest number of percutaneous injuries. However, other patient care providers, for example, physicians and EMS personnel, laboratory staff, and support personnel and housekeeping staff, are also at risk. Nurses are the predominant occupational group injured by needles and other sharps, in part because they are the largest segment of the workforce at most hospitals. Where, when, and how do injuries occur? Although sharp devices can cause injuries anywhere within the healthcare environment, NASH data show that the majority, 39%, of injuries occur on inpatient units, particularly medical floors and intensive care units, and in operating rooms. Injuries most often occur after use and before disposal of a sharp device, 40%, during use of a sharp device on a patient, 41%, and during or after disposal, 15%. There are many possible mechanisms of injury during each of these periods as shown in NASH data on hollow bore needle injuries. An exposure control plan is designed to identify in writing tasks and procedures, as well as job classifications where occupational exposure to blood or other potentially infectious materials occurs. This evaluation should be without regard to personal protective clothing and equipment. It must also set forth the schedule for implementing other provisions of OSHA's bloodborne pathogen standard and specify the procedure for evaluating circumstances surrounding exposure incidents. The plan must be accessible to employees and available to OSHA. Employers must review and update it at least annually and more often, if necessary, to accommodate workplace changes. An exposure control plan is important because it helps you protect your workers from exposures to blood and OPM. By protecting your workers, you also control exposure incident costs. An exposure control plan is meant to be a living document, used as a source of information for answering bloodborne pathogen-related questions and to help ensure exposure control activities are in place. If exposures to blood and OPM are reasonably anticipated, you are required by the Occupational Safety and Health Administration, OSHA, bloodborne pathogen standard to develop an exposure control plan. Be sure your facility's exposure control plan meets OSHA's criteria. It must be written specifically for your facility. Be site-specific. It must be reviewed and updated at least yearly to reflect changes such as new worker positions or technology used to reduce exposures to blood or body fluids. It must be readily available to all workers. You must regularly educate your workers on the uses of the exposure control plan and where it's kept, so it is available when needed. The bloodborne pathogen standard mandates certain precautions to prevent contact with blood or other potentially infectious materials among employees. It requires adherence to universal precautions, wherein employees must avoid contact with bodily fluids by utilizing non-porous items such as gloves, goggles, and face shields. Additionally, under circumstances where differentiating between body fluid types is difficult or impossible, all bodily fluids are deemed potentially infectious materials. Employees shall treat all blood and OPM with appropriate precautions, including the use of gloves, masks, and gowns when exposure is anticipated, as well as implementing engineering and work practice controls to limit exposure. This is crucial for preventing the transmission of HIV, hepatitis B virus, HBV, and other bloodborne pathogens during healthcare and first aid procedures. The bloodborne pathogen standard requires employees to observe universal precautions to prevent contact with blood or other potentially infectious materials. In situations where it is difficult or impossible to distinguish between different types of body fluids, all body fluids must be treated as potentially infectious. As a precaution, all blood and OPM should be handled using appropriate safety measures. These include wearing personal protective equipment such as gloves, masks, and gowns when exposure to blood or other potentially infectious material is anticipated. Studies show that as many as 1/3 of all sharps injuries occur during disposal. The Centers for Disease Control and Prevention, CDC, estimates that 62 to 88% of sharp injuries can be prevented simply by using safer medical devices such as luer lock and needleless systems. Additionally, according to the CDC, appropriate hand washing results in a reduced incidence of both nosocomial and community infections. Guidelines from national and international infection prevention and control organizations have repeatedly acknowledged that hand washing is the single most important procedure for preventing infections. Despite this, compliance with hand washing by healthcare providers is poor. Hand washing with plain soap, detergents, is effective in removing most transient microbial flora. The components of good hand washing include using an adequate amount of soap, rubbing the hands together to create some friction, and rinsing under running water. The mechanical action of washing and drying removes most of the transient bacteria present. Washing hands as promptly and thoroughly as possible between patient contacts and after contact with blood, body fluids, secretions, excretions, and equipment or articles contaminated by them is an important component of infection control and isolation precautions. General personal protective equipment guidelines encompass various precautions to ensure safety in different work environments. These include wearing gloves when handling blood or body fluids, utilizing safety shoes, boots, or covers to protect against splashing of blood and bodily fluids, and wearing aprons, gowns, or coveralls in similar situations. Respirators are essential when dealing with airborne hazards like tuberculosis. During cleanup and decontamination, OSHA requires the use of EPA-registered disinfectants that are effective against HPV and HIV. Cavicide that we use has been approved to meet this standard. It's important to remember when cleaning and disinfecting surfaces or equipment with blood or bodily fluids on them that we take appropriate precautions to continue to protect yourself against blood-borne exposure. Here are a few things to consider. When decontaminating our unit, it's important that we wear protective gloves and consider wiping up blood before decontaminating the surface. Dispose of blood and bodily fluids in an infectious waste container or bag and leave the surface wet with the disinfectant for 2 minutes before wiping away moisture. According to the Bloodborne Pathogen Standard, the Hepatitis B vaccination series must be made available to all employees who have had an occupational exposure. However, employees have the right to refuse the hepatitis B vaccination and any post-exposure follow-up. In the event that this occurs, a declination form must be completed and signed. An exposure incident is a specific eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials, as defined in the standard that results from the performance of a worker's duties. In the event you have an exposure to blood or any other potentially infectious materials, here are a few things that you can do. 1. Wash needles, sticks, and cuts with soap and water. 2. Flush splashes to the nose, mouth, or skin with water. 3. Irrigate eyes with clean water, saline, or a sterile irrigant. No scientific evidence shows that using antiseptics or squeezing the wound will reduce the risk of transmission of a bloodborne pathogen. Using a caustic agent such as bleach is not recommended. Report the exposure to the field supervisor or the risk and safety department. Prompt reporting is essential because, in some cases, post-exposure treatment may be recommended, and it should be started as soon as possible. Discuss the possible risks of acquiring hepatitis B, hepatitis C, and HIV, and the need for post-exposure treatment with the provider managing your exposure. You should have already received hepatitis B vaccine, which is extremely safe and effective in preventing hepatitis B infection. Thanks for watching. Stay safe out there.